I'm your host, Jennifer Pulapaka with Podiatry Doc Talk. Regain your health with quick and ingenious tips and chats so you can be stronger and healthier. I'm here, making complex foot and ankle problems sensible and simple. Episode 5. In this episode, Mrs. Jones comes to the office with the chief complaint of thick yellow toenails. First, she wants to know what it is and why she has it. And second, she wants to know how to treat this problem. Mycotic nails develop from a fungus. A fungus is an organism that lives in warm, dark, moist areas such as your shoes. Fungus in the toenails is a common problem and it can affect people of all ages, although it most commonly affects individuals who are older or who have immunosuppression. So how does it start? Well, toenail fungus often begins as an infection of the skin, also known as tinea pedis or athlete's foot. This fungus starts around the edge of the nail and eventually it makes its way over the nail edge and underneath the nail. Over time, the fungus starts to discolor the nail, thicken the nail by separating the layers, and also making them brittle and deformed. These changes sometimes can be permanent, whereas we can clear the infection, but the damage to the nail and the nail matrix from which the nail grows from was permanently disrupted. Similar to an incident where you may have shut your finger in a car door, damaged it way at the back, and now you always have a little mark in your nail. Fungus can do the same thing. It can make a nail permanently damaged. The treatment options. I most commonly use 3. Debridement, which is cutting, trimming, filing the nails. That's the most common one that I use for elderly patients. That helps keep the appearance more natural. The size is reduced, the thickness is reduced, and patients are able to wear their shoes without any pain or discomfort. The second option is topical. Right now, we have 2 that are FDA approved for nail fungus out in the market, but both of them are extremely expensive. They can cost up to $1,200 a bottle, and you'll need a bottle a month. Another alternative is Formula 3. That topical medication usually runs around $35 a bottle, but nails grow slow. Approximately 1 millimeter a month. Evaluate how much damage you have and see how much growth you need. Usually it's going to be about a year of treatment before we get clearance. Another option is oral medication. Lamisil is now generic, and it is an affordable treatment option. So if you have no history of liver disease or other medications that are metabolized through the liver, Lamisil may be an option for you. I do recommend that my patients watch their alcohol consumption and watch any other medications that they may be put on during this temporary period. This oral medication is given for 3 months. First month, you have a blood test before you start. 2 months into your medication, we will check your liver function again to see how it's working. Along with oral medication, I usually will prescribe a topical. I try to make this a full attack on the fungus to get those nails clear for you. Afterwards, you need to look at how you're taking care of your nails. That was a big factor as to what made you susceptible to nail fungus in the first place. Discontinue any harsh nail products. Switch to a more gentle formula, such as LVX nail polish. That's a 7 toxin-free nail polish. Additionally, move to a non-acetone nail polish remover. A lot of them may be too drying for the nail and the surrounding tissue, and that can make you susceptible to the fungus. Daily supplements like biotin work nice, but again, nails only grow 1 millimeter a month, so it's going to take a while for that nail strength to build up. Like your skin, nails can get overly dry or waterlogged. So use common sense as far as water exposure, and moisture is very beneficial to your nail. Remember a nail conditioner. Do not remove your cuticles, just push them back. And if you're going to go and have a manicure or a pedicure, take your instruments. They're more sanitary. When you're filing your nails at home, use the cheap red emery boards. Break them in half, and don't cross-contaminate amongst your own nails. If those nails have toenail fungus on it, don't spread it to your healthy ones. They're very affordable, so just throw them out after each use. Also, give your nails a break each year. Leave your polish off for 1 to 2 months, and that will help preserve your nails. Remember, Don't use anything like press-on nails, sculptured nails, or artificial nails on your toenail. These adornments make you more susceptible to toenail fungus and begin the breakdown process of the nail. Similarly, some home remedies can also break down the nail, such as tea tree oil mixtures and Vicks Vapor Rub. Now that I've explained the facts, I'm going to get Ms. Jones set up on her treatment plan so she can be on her way to healthy and beautiful nails.